Hello, and welcome to Healthwatch Newham's very first Lunch and Learn. Our topic of focus was mental health. Over this session, you will learn a lot more about ways for residents to connect with mental health services in and around the borough, and resources that are available for you as a resident if you're considering getting support for your mental health. This session focused on 4 main topics. These were mental health in Newham, the Healthwatch Newham's Community Listening Ears project, with our focus of this set quarter being mental health. We had speakers from Newham Talking Therapies, as well as speakers from the Newham Suicide Prevention Strategy. We hope you enjoy our webinar session, and please do reach out if you have any questions or any other further suggestions. And starting off with an introduction. So hello and welcome everyone. Next slide, please. We are Healthwatch Newham. So for those who aren't aware, Healthwatch is an independent statutory body that was set up as an offshoot of the Health and Social Care Act in 2012. There is a Healthwatch in every region in England, and we cater to the residents of Newham. We share information and advice with the residents to ensure that they get the support they need, and therefore acting as a health and social care champion. That means that we listen and we gather feedback through various projects and experiences that residents might share with us. We listen through social listening activities and gathering insights through community groups. We share this feedback directly with NHS leaders, local decision makers in the council and within social care services to help and guide local policies and strategies. Just so you know, Healthwatch is for everyone. So that's as long as you use any of the health and social care services within the borough, Healthwatch is for you. We want to hear from you, and the services that we can support range from GPs to care homes, hospitals to pharmacies. Next slide, please. A bit on Newham. So we are in the lovely borough of Newham. So Newham is an incredibly diverse borough. Over 73% of all residents are actually from the global majority. And so what that means is that the majority of residents within Newham are from ethnicities that are not necessarily English. Newham is one of the youngest boroughs in the UK, with a median age of 32.7 years old. Life expectancy in Newham is about 80 years for men and 83 years for women. So with all that being said, Newham does suffer from quite a bit of deprivation, but there has been improvements in the area since about 2015. However, it still remains within the top % of impoverished populations in the country, such as within barriers to housing and service and income deprivation that specifically affects older people. Why this is important? Because we know that poverty and deprivation has a direct link to poor mental health. Oh, next slide, please. The mental health needs assessment that was conducted in the London Borough of Newham can give us a bit more insight into what that looks like. So they found between 2016 and 2018, when this research was carried out, that the majority of residents, about 77% of residents, are quite satisfied with their life. But satisfaction is not necessarily the same as being mentally healthy, but it is related. So satisfaction varies from area and with the presence of disability and income. Personal resilience, which is how well people feel that they're able to tackle any issues that life can throw at them, is quite high, where 79% of residents describe themselves as being quite resilient. However, 1 in 5 adults has a low level of resilience. Low levels of resilience is more common where there is, next please, social isolation, next, disability, issues affecting older people, housing, and poverty. So these are some of the key issues that we find that the London Borough of Newham found that affects people's resilience. And we do know resilience is one of those key markers to mental health. So how well people are able to deal with things that life throws at them. But we also know that when life does throw issues at us, it is dependent on the environments that we live in as well, and how able we are to combat that. If we could go to a slide before, thank you. Common mental illness occurs in all ethnic groups. The Newham GP data did show that there was lower than expected levels of common mental illness for Black residents, and particularly lower levels in female Asian or female British ethnic groups as well. So what is common mental illness? Next slide, please. Common mental illness refers to illnesses such as depression, generalized anxiety disorder, panic disorder, OCD, or PTSD. It significantly impacts the lives of those that are with it. However, this can also impact well-being, relationships, families, social interactions, employment, experiences, etc. So we do know that when people are living with depression, people are living with PTSD, people are living with anxiety disorders, it does affect the way that they interact with services around them. Severe mental illness, slide before. Such as schizophrenia and bipolar are less common, but they still significantly affect numbers of people within Newham. Severe mental illness, the severity of mental illness changes over time. At its worst, it can affect with someone's perception of reality and severely affect someone's physical well-being, their daily activities, and employment prospects. Next slide, please. So this is just a little bit about severe mental illness within Newham. So data recorded by Newham's GPs shown in this graph above shows that there's a higher prevalence of severe mental illness in Black ethnic groups compared to white and Asian British ethnic groups. Women of Pakistani and Bangladeshi descent were found to have elevated risks of schizophrenia after we adjusted for things like socioeconomic disorder as well, because we do know that that does impact severe mental illness. The GPs within Newham shows that there's an underrepresentation of Asian groups, with the exception of the Bangladeshi community, and overrepresentation of Black British groups when reporting severe mental illness. Referrals for people from Bangladeshi, Pakistani, and African service users to mental health services such as the psychological therapies within Newham were a bit underrepresented when compared to, the vast diversity that we have within Newham. So that is something that we all consider when we think about the landscape of mental health. Next slide, please. So here I have a question for you. Feel free to drop some of the insights that you might have in the chat, but we've just spent a bit of time talking about what does mental health look like in Newham. And I want to ask you, what do you think will negatively impact someone's mental health? So if you want to drop any insights in the chat, it's just an exercise just to see what you all think. Some of those issues that we have raised in the chat are some things that are focused on within this slide. We also have things such as homelessness, grief, those people that are going through severe loss, genetics, family-related stress, bad relationships, sexual abuse, injury, violence, long-term conditions. So people living with long-term conditions such as cancer, type 2 diabetes can have a negative effect on life as well. So just a little bit about what negatively impacts people's mental health. So that is all from me, thinking about the landscape of mental health in Newham. Now we've got our brains thinking about what does mental health look like within Newham, what would negatively impact mental health. We've got a little bit of a conversation from Farheen, where she's going to discuss the Community Listening Ears project and what that is, what we're doing within Healthwatch to really examine mental health within Newham.